Hi, I'm Tom Swales. I'm a registered physiotherapist and a fellow of the Canadian Academy of Mandibular Physiotherapy. I have had the honor and privilege to train under some of the best manual therapists in Canada that they have to offer. And what I've really taken from the training, the examinations, the mentorship is not only the ability to critically appraise, assess the advanced manual therapy skills that have been taught, but to integrate it as a holistic approach with what my true passion is movement therapy and getting the human animal, the human athlete to optimize their movement performance. As an FCAM therapist, having done all the examinations and the work and the time it takes to master and perfect your skills, I've really brought that into our facility here at Concept of Movement to teach every client that comes in, treat them like a student. We hold mastermind sessions to teach what we learned to our peers and to our other professionals in the facility. And taking that wanting to learn ourselves, being lifelong learners as well as educators, we really translate that to the clients. Our clients come in and they are motivated. They want to know not only how to get better, but they want to know why. Why did this happen? How can I prevent this from happening again? And you show them, like, look, this shoulder pain came from this right hip dysfunction that came from a stiff ankle. You can really pull apart and get them to understand why they're in the dysfunction or pain that they're having. I love having the advanced manual therapy skills that the FCAM certification has given me. But what happens when the patient leaves your table? You have to go over and retrain the software. The manual therapy stuff, the needling, all the manual work that we do on our patients, it helps reset the hardware. But the software is the written programming that we use to move our bodies off the table. If we don't do something to reset the software, then the hardware just does what it's told to with the old crummy software that was once there as a compensation or as a poor pattern that was just written. What we've done is we've combined the manual therapy skills that resets the hardware with motor patterning and movement training and movement therapy to reset the software. When you can combine those two skill sets, you can get your patients that last 10 or 15% of performance that they were missing, possibly from somewhere else. So if you're looking to optimize your rehabilitation to get that last 10%, you can reach me at conceptofmovement.com or tomswell.com for more education on performance and rehabilitation.